Hello everyone and welcome to Edusurg Clinics. I am Dr. Gunjan Desai. I am a consultant GI and HPB surgeon at Lilavati Hospital, Mumbai. And today we are going to discuss some very commonly asked questions on the risk factors or the causes of pancreatic cancer and some of the strategies to prevent pancreatic cancer. So can we prevent a cancer? The answer is yes, to certain extent. You can't change genetics or hereditary factors. For now, there are some age factors that you can't change. But there are, of course, some factors in our control which we can change, and that is what we are going to see. So we'll see what the pancreas does in the body, where it is located, what are the symptoms and signs of pancreatic cancer. And with this awareness and education, you can probably take some effective measures to be in charge of your health and try and prevent or at least detect cancers early. So let us first see where the pancreas is located in your body. This is the area pancreas is located right at the back. Okay, it is very close to the spinal cord or the vertebral column in medical terms. If we see the common digestive system, you might not even notice the pancreas, but it is this yellow structure that is located behind the stomach and colon. And actually, this is how the pancreas is located in the body, right at the back. For the system that we look into, the liver, gallbladder, and pancreas, this is how the pancreas is located. The pancreatic duct joins the bile duct and opens into the duodenum or the small intestine via the ampulla. Now, a very simple point actually, but very commonly asked and misunderstood concepts on what does the pancreas do, how it is important in our body. Pancreas has two very important functions in the body. One is that it is the enzymatic storehouse of the body. So whether it is digesting fat, protein, or sugar, which are the three key components of our nutrition, the digestive enzymes are produced by pancreas. So the amylase, lipase, and all the other enzymes for sugar and fat are produced by pancreas. Important point, pancreas produces insulin, okay, the beta cells of the islet of Langerhans, and this helps in sugar metabolism, and insulin resistance or insulin absence can result in diabetes. So these are two very important functions of pancreas, but they are not the only functions of pancreas. It also secretes water and alkali, and this helps in neutralizing the stomach acid. So beautiful is the design of the GI system by nature, that the stomach has acid which helps in killing the bacteria, and then the acid needs to be neutralized in the intestine for digestion. And this neutralization function to a large extent is carried out by pancreas. Another important point is the islet of Langerhans, which has multiple hormones. So pancreas produces enzymes as well as hormones, and these hormones are important in maintaining body balance and homeostasis. Sugar balance is maintained by the hormone insulin and glucagon. So with this knowledge in mind, let us see what are the common risk factors for pancreatic cancer. Most important risk factors are alcohol and smoking. The other important risk factor is obesity. Now, just as we saw in liver, or if you have not seen that video, we should know that most of the liver cancers arise from what is known as chronic liver disease or long-standing liver disease. And that is why the focus of prevention has been on identifying patients with long-standing disease. Similarly, in pancreatic cancer, the most important risk factor is chronic pancreatitis. When we say chronic, it is long-standing pancreatic inflammation. There are multiple causes of chronic pancreatitis, but for the sake of listing the most common causes, it is alcohol, smoking, and gallstones. These three together account for nearly 40 to 50% of chronic pancreatitis. The next most common cause is hereditary and idiopathic. Drug-induced or viral chronic pancreatitis, we have seen cases due to COVID also. So pancreatitis, especially chronic pancreatitis, is a predisposing factor for pancreatic cancer. Understand that this provides the scope for prevention. So if you understand the risk factors, if you have them, you can start taking steps to prevent cancer. When we come to non-modifiable risk factors, unfortunately, pancreas has a very long list of non-modifiable risk factors. age more than 45 to 50, and male gender is predisposed. Pancreatic cancer tends to run in family. So if you have family history of cancer, this is one of the very important points where you can identify if you are at risk due to a familial risk of cancer. So anyone who's looking at this video and has a family risk of cancer, meet your doctor, contact us, get to know if you fit a syndromic association, and then start your preventive action. So hereditary breast and ovarian cancer syndrome, familial atypical multiple mole melanoma syndrome, hereditary colorectal cancer syndromes, familial pancreatitis, and Peutz-Jeghers syndromes. You don't need to learn these syndromes. You just need to understand that if there is a cancer in the family, always ask your treating doctor if there is a hereditary risk. There are some common symptoms by which you can identify pancreatic disease. A very important point is if there is diabetes occurring after the age of 45 to 50, always screen the abdomen for pancreatic cancer. This is an area where you can identify disease early. So new onset diabetes in adults, jaundice we have already seen, unplanned weight loss and loss of appetite you will see in each and every cancer prevention or cancer symptom video. Unplanned weight loss and loss of appetite are very important red flag signs for cancer in general. Greasy, sticky stools, because as I said, pancreas is the storehouse when it comes to food digestion. So if the digestion is not good, it results in greasy, sticky stools. Feeling of a lump in abdomen, which is usually gallbladder, nausea or vomiting may be present. Back pain is a very classical symptom of pancreatic diseases. If you have pain in the central upper abdomen that is going to the back, immediately contact your doctor. So now once we know these risk factors and the symptoms and signs of pancreatic cancer, one of the most important preventive measures is lifestyle and diet. Have a target to quit alcohol and smoking, and weight control, exercise, diabetes and obesity treatment. Know your hereditary risk. This is very important when it comes to pancreatic and colorectal cancers. Screening is important. Genetic counseling may be required if your doctor feels the need, and testing if it is required. These tests are now available. So if you see these symptoms or if you have a hereditary profile, meet your doctor immediately and discuss your concerns. Just like chronic liver disease, all patients with chronic pancreatic disease need awareness and education and a regular follow-up with doctor. If you get lost to follow up, it is very difficult for the doctor to identify disease early. And the biggest problem in cancer currently is the lack of tools to identify disease early. Half the battle is lost when we see disease in advanced stages. So screening, surveillance, and prevention, these are the terms that will help us in fighting cancer. Screening can be done with ultrasound, CT, MRI, and blood tests. Blood tests are tumor markers basically. So once you know all these factors, take charge of your health. If you see any of these symptoms or if you have doubt regarding your hereditary profile, meet your doctor, get assessed, be in surveillance if you have chronic pancreatic disease. Take steps to be aware and identify disease early and prevent disease if it's possible. Thank you.